afternoon, everyone. My name is Zane Ismail, Manager of Innovation and Partnerships at Leamington Hospital, and we're Team LA Squared, a partnership between Leamington Hospital and Leamington High School. Yes, a high school.
We have a problem. I don't have a way to effectively communicate my mental health issues at the point of care.
So, we're creating an app to help teens record their mental health and wellness information. Our goal is to help record and connect our circle of care with us. We've used a co-design model in which the end users, like me, collaborate in the developmental process. So who cares?
I care. When my caregiver asks me what's going on, it's hard for me to remember the details of it and to keep it all straight. So who cares?
Well, my caregivers care. My mom, doctor, nurses, trusted adults, my guidance counselor. My social worker would love to know when I'm having an issue. They want to know where it happened, the severity, and why. It's all about the moment. So who cares?
My community cares. Stakeholders benefit when my caregivers and I are on the same page.
Now, let's see how we will be on the same page. User interface design is very important to me as a teenager. If I'm going to use an app, I want it to be fresh, be engaging, and interactive. I need it to generate a report so that my healthcare provider can use it to start a conversation with me so I get the most out of my visit. With this app and its user-friendly layout, I will be able to locate my symptoms and rate them on an emoticon design scale. I can record triggers, date, time, how I want in the moment, easily, efficiently, with only a few taps. As a teenager, I like to customize things in my own way. With the Moment app, I can select what I want to track and I can change it anytime I want. Fresh, efficient, helpful, and customizable. This is my app for my moments.
And with all of my moments stored in the tracker, I can share a meaningful report connecting my symptoms and triggers with my circle of care. For example, how school and work relate to my anxiety. Now I have the tool to effectively communicate with my caregivers, and now we are on the same page.
Perfect. So who cares about the money? My boss cares, and she's actually seated right here. We've identified Bell Let's Talk as a potential source of funding. We are looking for $5,000 to further continue the iteration process in version 1 of our app. Bell Let's Talk is a $74 million community fund that funds mental health community projects just like ours. We've also took a look at what are some additions our app could have moving forward. In version 4, we will seek to actually implement this app as a tool into an existing personal health record we're launching in Windsor, Essex.
What mental conditions does this cover?
So this covers a whole gamut of conditions that we've sought input from our local, circle of care providers. Everybody from guidance counselors to social workers within our school, or consultants, mental health resource workers at the hospital also provided input. ER doctors and family care physicians all provided us with a list of their commonly treated conditions. As well, teams can actually go in and customize things. So if they've received a diagnosis, say they've added psychosis to their list because they've got an official diagnosis, they can add that in at a later time. So they can check off the ones that they commonly, that are commonly associated with the teen experience, like anxiety, stress, anger, that kind of stuff. But it's fully customizable, so a healthcare practitioner could diagnose them. They can add that in later. So we've got a list from all these providers.
One more question. So is it real time or periodically updated to your physician? So just in case there's a series of conditions, but you never go in to see your doctor, does it?
So this actually doesn't get pushed to the physician. This would be a conversation starter with the physician. So the teen is going to track this information with their app and then bring that into the physician or their practitioner, whatever sort it is, and they're going to bring that in and it's going to start conversations. They're going to be able to generate a PDF report and email it because that's what they told us that they wanted to have. Because of the different record keeping of psychologists, psychiatrists, ER doctors, everybody.
Excellent. So like a personal health record type thing.
Exactly. Very portable.